Welcome to Transitioning to Medicare Part 1. My name is Lois Romeo, and I'm from the local SHIP office, which is the State Health Insurance Assistance Program. We're here to give you local help. It's no cost, it's confidential, and it's unbiased, and we're helped with Medicare. We're all trained counselors. Most of us are volunteers, but we have to go through lots of education and take tests and all to make sure that we're able to pass along the information you need. We're here to do education, one-on-one counseling by appointment, which these days right now is over the phone. We can do benefit program reviews. We can give you application assistance and help you with problem resolution. It's available to all Carroll County residents. And as you'll see by this chart, it's actually available around the nation, but this is a list of the SHIP offices within the state of Maryland. So if you have a friend that says, gee, I'd like to be able to get that help, and they don't live in Carroll County, you could pass along this information to you and it'll give you the phone number for them to call. So let's talk about Medicare to start with. It's health insurance, and most people think of it as health insurance for people over 65. It's also health insurance for people under 65 with certain disabilities and at any stage if they have end-stage renal disease. It was first enacted in 1965. And as of 2019, there's 61.4 million people on Medicare, and it's projected to grow to 80 million by 2030. 10,000 people a day enroll in Medicare. So if you have trouble getting through to a central number, just be aware that's part of what's going on. The Part D, or prescription drug benefit, which we'll talk about all the parts later, but that did not become effective till 2006, when it was obvious that prescriptions were a big part of the Medicare or the medical expenses for the beneficiaries. So let's start with, how do you enroll in Medicare? Because this can be confusing for a lot of people. You're going to enroll in Medicare one of two ways. You can enroll through the Social Security Administration, or through, if you are a retiree, the Railroad Board, you can go through the Railroad Retirement Board. That is your enrollment for Medicare. Once you're enrolled, the administration of Medicare is what occurs through the Centers for Medicare and Medicaid Services, or CMS. So this can be automatic for you. If you're already receiving either a Social Security check or a Railroad Retirement Benefit check, then enrollment in Medicare is automatic. In that situation, what will happen is you'll get an initial enrollment period package. It'll get mailed to you 3 months before you turn the month that you turn 65, or it'll get mailed to you the 25th month of disability benefits. And it will include your Medicare card right in there. And don't be confused, because as you become eligible, you're going to get lots of mailings that they try to make look just like this package. So it's fine to toss away the ads, but first open it up and make sure that it doesn't contain your Medicare card. However, if you're not receiving social benefits, then you would need to proactively enroll in Medicare. And you can do that one of three ways. You can go online to the ssa.gov, which the link is right here. You can do it at your local Social Security office in Westminster, and this is the number to get through to them. Right now, by the way, be aware that is all. It is not people at the office anymore. And you're probably a whole lot better off going to the ssa.gov and setting that up that way, because then it gets registered as soon as you try to enroll. If you're a retired railroad worker, then you're going to enroll with RRB. So this is at your local RRB office or at the phone number that you'd find on the screen. So when should you be enrolling in Medicare? You're going to hear the term initial enrollment period lots of times in this presentation. That is a 7-month period, and it starts with the 3 months before the month you turn 65 through 3 months after you turn 65. So if you look at this chart, what it's trying to explain to you is if you do your enrollment in that 3-month period, and we recommend you get busy and do that enrollment really 3 months ahead, because then you know you've got all your stuff set up by the time you turn 65. If you do your enrollment in that time period, then it will become effective the month you turn 65. It's not going to become effective on your birthday. It's going to become effective the first day of the month you turn 65, unless you were born on the first day of the month. If so, it's actually going to become effective a month earlier on the first day of the month. So you want to start a little sooner if your birthday is the first day of the month. So if you wait and don't do your enrollment until the month you turn 65, then it will not become effective until a month after you sign up. And as you can see, if you wait till the 5th, 6th, or 7th month of this, you will have some delay. And this just gives you the amount of time that you can expect to have it be delayed. There are some other times you can enroll, but you may be responsible for a penalty. And we'll talk about that as we go forward. So what is Medicare? What does it cover? It's got 4 parts to it. Part A is your hospital insurance, and that includes being admitted to the hospital, so inpatient hospital care. It will include skilled nursing facility care, so if you've come out of the hospital and had to go to rehab, that type of thing. Not a nursing home, but skilled nursing facility care. Some home health care and hospice care all fall under Part A. Part B is your medical insurance. So think of that as everything else except your prescription drugs. So it's doctor's visits, labs, x-rays, emergency room, outpatient therapy, things like chemo treatments that are outpatient, preventative services, kidney dialysis, mental health. All of those types of things fall under Part B medical insurance. Part D is your Medicare prescription drug coverage. And then Part C is actually an alternative way of receiving your Medicare that's called a Medicare Advantage plan. It's also what you will be getting a whole lot of your ads from. And that actually includes Part A and B, so hospital and medical, and usually will include Part D coverage. Medicare wants you to stay healthy. So they cover a whole lot of Medicare preventative services that you do not have any kind of coinsurance you have to pay on those. And that's true as long as you go to a doctor who accepts Medicare assignment, which we'll spend some time on down the line. When you're first signing up for Medicare, and then each year after that, you will get a Medicare and You book, and it'll tell you anything that's changed, and it'll give you all the guidance around what is covered by Medicare. When you look at that in 2021, the pages 30 to 51, that'll tell you the complete list of preventative services. So it's worth getting acquainted with it, because again, they want you to do this and stay healthy. So let's talk about your alternate ways of being able to receive your Medicare. If you look at this chart, there's a left-hand side and a right-hand side. You can be over under original Medicare, or you can be on a Medicare Advantage plan. You pick one or the other. So Part A, original Medicare is going to have Part A and B. And if you look at this chart, the other thing to be aware of is Part A and B is administered by, under original Medicare, is administered by CMS. So that's the administration part we were talking about. All the other blocks on here, so the Medigap, the prescription drug plan, and Medicare Advantage plans, those are all guided and have to follow the rules set up by CMS and provide the services defined by CMS, but they are private companies. So they do their own pricing and, have to go through reviews, et cetera, but they would be actually doing the administration. Those private companies would be doing the administration of those parts that you see on this chart. So original Medicare is going to have Part A and B. It's going to have, which again is your hospital insurance and medical insurance. If you choose to, it will include a Medicare Supplement insurance plan. And you will need to decide if you need a drug coverage plan. And we'll talk about each of those parts as we go through the presentation. Medicare Advantage plan is a little different setup. It's more like what you've been used to in many of your employer plans, like an HMO or a PPO. Just to not get lost in the terminology, an HMO, both of these types of plans would have a set of doctors and facilities that are in network for them. And many of them will require referrals. If you choose an HMO and you go outside that network of facilities and doctors, then you pay all the cost. You have no coverage. If you join a PPO and go outside that network, you're going to pay 30 to 50% or a flat fee of the cost of going to those doctors and facilities. So you'll pay more than you would if you stay in network, but you do have coverage. All but one of the plans offered in Carroll County of Medicare Advantage plans does have a prescription drug coverage within the plan. If you were to pick one of these plans without prescription drug coverage, you may not pick up a Part D prescription drug plan. So you would only want to pick that if you have some alternative coverage for your drugs. The other thing to be aware of on this chart is if you pick a Medicare Advantage plan, you may not use nor be sold a Medicare Supplement insurance plan. Those do not come together. That can only be sold to you if you're over under original Medicare. So let's start with the parts of Medicare under original Medicare. First question is, should you keep or sign up for Part A? For most people, the answer to that question is yes, and that's because it's premium free for most people. You would contact Social Security to sign up for it. The one reason that it may not make sense for you to sign up for Part A is if you have and are contributing to a health savings account. So let's assume you're still working, you or your spouse, so you have active employment coverage. Most people will still pick up Part A just because it gives them some additional coverage and they're not paying anything for it. However, if they are contributing to an HSA, they may want to wait until they no longer have that employer active employment coverage. Because once you've signed up for Medicare, Part A or B, then you can no longer contribute to an HSA tax-free. And you're able to use the funds you've put in that HSA, but you can no longer contribute to it or you will be in a tax penalty situation. The harder question for many people is, should you keep or sign up for Part B? And this is where you need to look at your individual circumstances. You may want to delay Part B if you have medical coverage through active employment, either yours or your spouse's. If you don't have medical coverage from active employment, then you probably are going to want to enroll. So there are some people that, for instance, retired federal employees who are eligible for Part B, but need to do some further assessment. They really need to understand the implications with with O&B. Delaying Part B, however, can result in higher premiums and or paying for your healthcare out of pocket. And it can create a situation where you would have a penalty. You should check with your HR department. There is no penalty if you enroll within 8 months of losing coverage through active employment. Most people don't wait that long because they want to have continuing coverage. So there are times you have to have Part B, and that is if you want to buy a Medigap as a secondary, you have to have both Part A and B. If you want to join a Medicare Advantage plan, you have to have A and B. Also, if you're eligible for TRICARE, they require it. And then there are employers, some employer coverage requires that you have both Part A and B. So that's why sort of a starting point for you is to determine whether your employer requires it, even with either you or your spouse having active employee coverage. If you have veterans benefits, healthcare benefits, then you may choose not to sign up for Part B. So that we do see people with veterans benefits that sign up for Part B, but you don't have to. If you sign up later, and don't do it during your initial enrollment period, or certain special conditions will cover, then you may have to pay a penalty. So when do you enroll in Part B? During that 7-month initial enrollment period we talked about. So again, 3 months before the month you turn 65 through 3 months after you turn 65. Within 8 months of retiring from active employment. So no longer having that active employment coverage either through yourself or your spouse. If you miss your enrollment period, then the only time you can enroll in Part B is January through March of a given each year. And your coverage won't even start until July of that year. In addition to that, you'll pay a late penalty. So the late penalty is 10% of the premium for every 12 months you were eligible for Part B that you did not take it. So 10%, if you're paying $148.50 for your premium for Part B, you're basically going to pay another $15 on top of that every single month for the rest of your life. Okay, probably not something you want to do. So you want to pay attention to when the enrollment periods are. So your Medicare card, when you're signing up, when you're having to actively sign up, you can choose to sign up just for enroll in Part A and not sign up for Part B to start with. If so, then you'll get a card that looks like this, and it's going to have just the hospital Part A showing a coverage date. However, if you're already on Social Security or disability for 25 months, you're going to get a card that looks like this in the mail automatically. What you need to do if you do not want Part B is you need to return it to refuse Part B. And there will be instructions that come with the card. You'll follow the instructions and return the card. And then they will send you a new one that just shows Part A instead of Part A and B. The other thing of note here is one of the issues for fraud for Medicare was these cards used to contain your Social Security number. You'll see that looks nothing like a Social Security number. So that's one of the things they've done to help fight fraud. Okay, so now that you have an idea how to get enrolled in Medicare, let's talk about the coverage and the costs that you have under those coverages. So again, Part A for most people is premium free. If either you or your spouse have worked for at least 40 quarters and paid into FICA all that time, then you do not pay a premium for Part A, the hospital coverage. If you've worked, say, 30 quarters, you would pay a prorated amount against it. And if you haven't worked anywhere you've paid into FICA, you could choose to buy Part A. So let's assume now that you have Part A and you had to go to the hospital. If you were admitted to the hospital, this is not outpatient emergency room. This is if you're actually admitted to the hospital, then you would be responsible, if you have no other coverage, you'd be responsible for $1,484 before Medicare starts paying coverage. After that, they're going to cover up to 60 days of hospitalization for you. After that, you would start paying a copay of $371 for the next 30 days of hospitalization in that benefit period. And then, as you can see, there's a much more expensive, that is a one-time situation that if you had to go over 90 days in a benefit period, there's something called a 60 lifetime reserve days. That's 60 days across your life that maybe you would use 2 one time you're in and another 5 another time, but it would never add up to more than 60 across all that time period. After that, you would be responsible for paying all the costs. So let's talk about what a benefit period is. A benefit period is defined by, different than your 60 days of hospitalization, defined by the last time you got out of either the hospital or the skilled nursing facility, whichever came last. If you have not been at either one for 60 days, 60 calendar days now, then you would start a new benefit period. So We'll give you an example of this. If you went into the hospital in January and came out in January, went back in February, came out in February, went back in March and came out in March, you are still in that same benefit period. However, if you went in January, came out in January, and didn't go back in again until, say, April, you've had more than 60 days pass from the last time you got out. You would start a new benefit period and would be responsible for the $1,484 all over again. So unlike Part B, which runs on an annual basis, this is defined by benefit period, and you can have multiple benefit periods across a calendar year. If you did get admitted to the hospital, and make sure you know whether you have or not, they are responsible after 24 hours if you go into a emergency room to explain to you, there's a document you're supposed to get which defines whether you're still in observation. So if you have any question about that, make sure you ask them. And it matters for a couple of reasons. It's where your bills will, fall in under Part A or Part B, but it's also important because if you've been admitted 3 full days, not including the day you would be discharged, but then had to go to a skilled nursing facility, then you will have the first 20 days of that will be covered. And after that, you pay a co-insurance. If you were not admitted for those 3 full days, then you do not have coverage when you go to a skilled nursing facility. So again, important to understand that implication. Let's flip down to medical insurance. Medical insurance, again, let's go back to what that is. That includes your doctors, your labs, your x-rays, cancer treatments, dialysis, all of the above, even durable medical equipment, which are things like wheelchairs. You will pay $148.50 per month. It could be higher than that because it can be income adjusted if you make over certain amounts, which I'll show you at the end of the presentation. And that, if you are already taking Social Security, that $148.50 per month will come off right at the top of your check before you ever see it. After that, if you are not yet on taking Social Security, then what will happen is you'll get a quarterly bill for 3 times that amount. So now you're paying a premium for that monthly. There's also a Part B deductible, and that's $203 per year. So the first $203 a year that you're responsible for from Medicare, for having had treatments at doctors, et cetera, under all the new plans, you have responsibility for. After that, Medicare is going to pay 80%. You're going to be responsible for 20%. And again, this all assumes right now that you do not have any other coverage. The variation on that is if a doctor or facility does not accept assignment, what that actually means is they have not agreed to the rate that Medicare will pay for that particular procedure. They still are bound to that amount, but can charge up to 15% more. So under a normal condition, if you go to someone who accepts assignment and it's a $100 bill, Medicare is going to pay $80, you're responsible for $20. However, if you go to someone who does not accept assignment, then Medicare will still work off that $100 figure and pay the $80. You'd be responsible for the $20, and if the doctor's billing $115, you'd be responsible for the $20 plus the other $15, so $35. Okay. Let's go back now to the concept of if you're under original Medicare. We've talked about Part A and B and what some of your co-insurances are. So, one of the questions then is do you want to pick up supplemental insurance? First off, a great majority of our residents in Carroll County are under original Medicare, and they are over there, particularly if they can afford to buy a Medigap, because they can get a pretty standard view of what their costs will be. They know they're going to pay a premium for Part B. They know they're going to pay a premium for the Medigap or a supplement. And they know they're going to, we can define for them by running it for them, what they're going to have to pay for drug coverage. So it gives them a fairly predictable flow of what their costs will be for the year. So what is a Medigap policy? So these are supplement insurance policies. One thing to make very clear, again, they're sold by private companies. One thing to make very clear, when it says it's designed to fill the gaps in original Medicare, that does not mean if something is not covered by original Medicare that this will cover it. What it does mean is it will cover, depending on the plan you pick, the deductibles or coinsurance. So in order for your Medigap to pay for something, the difference, the deductibles or the coinsurance, then it has to be a service that's covered by original Medicare. Standardized plans, Medigaps have standardized plans all with the same letter. And if it's the same letter, even though you're going to have different companies that have their own cost equation, then they have to give you the same coverage under Medicare. So what they cover is defined through Medicare. What they are going to charge you for that will vary by company. So the question is, do you need a Medigap policy? So one of the questions is, do you have other supplemental coverage, such as, a former employee, like a retiree plan? Do you have TRICARE? Are you only planning on using your veterans' health care benefits? In any of those situations, you might not need a Medigap. The other question to ask is, can you afford Medicare deductibles and copayments? We put the link right in here. This is an excellent book, and I highly recommend you read it, and preferably before you start thinking through part 2 presentation that we give on this. And that's a book called Choosing a Medigap Policy. It will go into lots of detail about everything I'm talking about here. So if you do think you want a Medigap plan type, then you have to make a decision about what letter you want. And in those letters, this is not to be confused as Part A and Part B. This is now Medigap Plan Type A, Type B, Type D, etc. If you look down the left-hand side, you'll see the coinsurances and deductibles that we listed on the earlier page. And if you go across the chart, if it has an X in that, it means it pays for that if you pick that plan type. So I'm going to really talk to 2 plan types. G and an N. And I'm only doing that because those are some of the most commonly chosen plan types. So first off, as of January 1 of 2020, there used to be plans that would that if you were eligible for Medicare before that, you were able to pick something called a Plan F, which somebody might tell you to go get. You're only eligible for that if you were eligible for Medicare prior to the end of 2019. As of January of last year, their Plan F is no longer offered. It was grandfathered in for people that had it, but it's no longer offered to new people coming on. It's not a big deal because Plan G was what a lot of people were picking anyway. So Plan G, if you look down the columns, you will see that there's an X in every one of those boxes except the Medicare Part B deductible. So that first $203 that you spend on doctors and labs, et cetera, in a year, you will be responsible for your Part B premium and you'll be responsible for that Part B deductible. But after that, if you pick a Plan G, if it's a service that's covered by Medicare, your Medigap is going to pick up all the remainder coinsurance or deductible. As you can imagine, because it covers all that, it's also going to be your most expensive plans for the average person. So let's go over to N for a minute. N will definitely be less cost. And the things it covers, well, I should say the things it does not cover, it's not going to pay that $203 Part B deductible. It will not pay the up to 15% excess charges. Those are for the folks who don't, or facilities that don't accept assignment. If you go to somebody that doesn't accept it, then you would be responsible for that other 15% under a Plan N. The other thing is when you go, and this is down on if you'll look down on the chart, you'll see it. If you pick a Plan N, then when you go to a doctor or facility, you're going to pay up to $20 for that visit. And if you go to an emergency room, you're going to pay up to $50 for that visit if you do not get put into the hospital. If you are admitted to the hospital, you will not pay that $50. The only other thing I'll highlight very quickly for you is the G high deductible plan. Some people, you know, will go that path, and it's defined in there for you. In that choice, you're going to have a much lower premium for a G, but you're also then responsible not only for that $203 Part B deductible, but also for the first $2,370 so that you would spend as a deductible as well. And then after that, you know, after that, the policy is going to pay for anything else that you would incur. So think of it as sort of a catastrophic coverage kind of plan. Okay, so Medigap plans, it's important to understand something called guaranteed issue rights. And the guaranteed issue rights allow you to buy a Medigap without medical underwriting. And that is very important because that's going to give you then the lowest rates. They're not going to be looking at your health. So every 65-year-old that has a 65-year-old and Part B in those first 6 months can come in, pick a Medigap. If you pick it then, or as you first go on to disability, then they have to give you a policy and it's going to be at the lowest rates you're going to get it. Any other time you might choose to decide you would change or want to change or pick up a Medigap at some other points, but you will normally be responsible for them to do a medical underwriting on you, and therefore your rates will normally be higher. So the other time that you get guaranteed issue rights, but it's a 63-day period, would be after an Advantage plan or active employment group health plan ends. So this is just a really important concept for you. It's also one of the big reasons that people that have active employer coverage, you know, choose to wait until they no longer have that to pick up their Part B, because they really don't want that 6-month guaranteed issue right period to kick in, and they're paying for a Part B premium that they might not get much advantage from because it's really already covered by their employer. So how do you determine the right Medigap policy for you? Well, first off, these presentations, there's a Part 1 and a Part 2. The second cycle, Part 2, we'll spend a lot of time on the differences in choosing, et cetera, a Medigap policy versus doing the Medicare Advantage side of the equation. But if you want to look at these, you can go into the tabs that we show here. And my recommendation would be to go to the Maryland Insurance site, because the Maryland Insurance site will not only give you the comparisons that you can get under Medicare.gov, but it'll also show you the annual premiums for those policies. So you can just get more information there, is why I recommend going to that site instead. Okay. So the other thing you would have to decide under Original Medicare is, do you need to pick up a drug coverage? You know, some people say, I don't take any drugs. Why would I pick up prescription drug coverage? Well, part of the reason is because if you don't pick it up up front, you're going to pay a penalty the rest of your life when you need it. And that's not just because they want to punish people. It's because if people did not sign up until they had very expensive drugs, there would be no prescription drug coverage. It would all just go under. So the nice part about the prescription drug coverage is we can easily run, or you can, on the Medicare site, a comparison for you that'll tell you exactly what you spend. So before I switch to Medicare Advantage plan and go through the rest of D, again, you can have a pretty defined view of what you're going to spend across a year under Original Medicare if you have a Medigap and you have drug coverage. So first off, you have to have either Part A or B to be able to, and or both, to be able to sign up for Medicare prescription drug coverage. This you do have to actively enroll yourself for. You can delay the enrollment with no penalty if you have creditable drug coverage through you or your spouse's active employment. that is just an equation that looks at it and says that that coverage that you've got is equal to or better than what you would have under Medicare. You are supposed to be getting a drug coverage notice every year that tells you whether your drug coverage is credible or not. So just make sure you hold on to those in case you need them down the line. But they have to send that to you. So when can you enroll in a Part D? You can do it during your 7-month initial enrollment period. You can do it, and unlike the Medigap that we said you're going to pick and you're going to kind of stay there, this is something we recommend you look at every single year. And you can do it every year during open enrollment, which is every year from October 15th through December 7th. And when you pick it during that time frame, your coverage is going to begin January 1 of the following year. You may also do it within 63 days of losing employer or retiree creditable coverage. Otherwise, again, there's a late enrollment penalty. This time it's 1% of the base rate for each month you didn't have it. And again, you're going to pay that the rest of your life. So it's good to avoid that. If you're signing up other than during open enrollment, then your Plan D coverage will start the first of the following month. So what do you pay for Part D prescription drug plan? You're going to pay a monthly premium. That'll include the plan premium. If you have an income adjustment, again, because of what you make, then you might pay more than that. And if you have any penalties, that's all going to be under considered monthly premium. There will be a yearly deductible that applies once across the year, and each plan can apply that, either choose to do between $0 and $445, and they can choose how it gets applied. So then you're also going to have a co-payment or co-insurance. Preferred pharmacies will be less expensive. Many of the programs have setups where you pay a co-insurance of $0 if it's a tier 1 or 2 drug, meaning it's going to be your base preferred generic kind of drugs. You do not want to pick based on one of these elements. That's why it's so important to run the comparison, and that comparison will look at all those elements to tell you what your lowest cost for the year would be. You've probably heard of the dreaded donut hole. It's less of a problem than it used to be because it's been, it's the drug costs that you spend going in. That is not what you've paid. That $4,130, if the drugs you're taking have a cost overall of that by the time you've filled it a number of times, then you go into the donut hole or coverage gap, it's also referred to. You will in that pay 25% of the brand name or a generic, unless that plan has negotiated something lower, which sometimes happens. Then there's another area where you actually would have spent enough money that you fall into something called catastrophic coverage. And if you fall into that, you're going to pay either 5% of the cost of that drug or a standard $920 for a brand name drug and $370 for a generic drug. It would be whichever is greater. So if 5% is greater than $9.20, you're going to pay the 5%. So we have a lot of people that never ever fall into the donut hole, and we have people that go into it the first month of the year. So, that's why, again, it's very important to run the comparison. So the things you're going to want to consider when you try to figure out what's the best plan for you is who are preferred pharmacies with that particular plan, what drugs are on their formularies, because that's going to affect whether they pay something for it for you, whether it needs a pre-authorization from your doctor to be able to take that drug, and step therapy, which would be a situation where if they believe a generic would work better than your brand or as well as your brand, they may require you before they pay for the brand to attempt the generic first. These are things that would be, your doctor gets involved with the plan as appropriate. Nice part is there's a wonderful system out there, and you can, for enrolling in Part D, You can go right on the Medicare site and look at this system and run a comparison. You can call the plans directly, but that would start getting very complex. You could call Medicare, or you can call us at the SHIP office, and we can run those comparisons for you and work with you, because you actually would put in your drugs, where you like to shop for them, etc. And we can tell you what would be your lowest cost. Do plan on looking at that drug plan every year, because the plans change, your prescriptions change. So it is worth reviewing that every single year, both your prescription drug plan, and if you're on a Medicare Advantage plan, the Medicare Advantage plan every year. Those that you change in open enrollment will be effective January 1 of the following year. So let's flip now to Medicare Advantage plan. Okay. So again, you can be on the left-hand side or you can be on the right-hand side. On this, the reason people will pick this side of the equation sometimes is because they like an upper limit on what their out-of-pocket spending can be. So number one, you may pay less in your premiums. You have some options to pick up some things like hearing and dental and vision that are not covered by original Medicare. So just to clarify that, original Medicare, if you have a cataract, it's going to pay to repair that cataract. If you want to fix astigmatism when you have that cataract surgery, you're going to pay for the astigmatism repair under original Medicare. You might have some coverage for that under a given Medicare Advantage plan. So the second part of these presentations, we'll spend a lot of time on understanding what that is. But if you are in an HMO and go outside your network again, you will be responsible for paying all costs. So there is no out-of-pocket limit on the out-of-network for an HMO. On both an HMO and PPO, if you stay fully in network, the plans will vary, but they will have an out-of-pocket limit somewhere between $6,700 and $7,550, I believe it is this year, that you would be responsible for in co-insurances and co-payments, that type of thing. And then after that, they would cover everything except excluding your drugs or outside that. If you have a PPO, there will be an upper limit if you had that's higher, which we'll cover next time, for the combination of the in-network and out-of-network. So should you join a Medicare Advantage plan? Well, first off, you do have to have both Part A and B. You still pay your Part B premium, so that's the $148.50 a month, and you have a monthly plan premium. They will have a network of doctors, and you may be required to have a referral to see a specialist. There will be co-pays and co-insurance. Again, they have some benefits not covered on the other side. Again, if you pick up a Medicare Advantage plan, you can't use and can't be sold a Medicare Supplement insurance. So the plans that are available for 2021 in Carroll County, which again, this can vary by year, and we'll talk about this in a lot more depth next week on the Part 2. Johns Hopkins has 1 HMO, 2 PPOs, and you could look down the list. The University of Maryland dual plan, that's only for people that are at like a Medicaid type level, which is what the dual eligible or QMB stands for. That plan is transitioning to become a Blue Cross and Blue Shield plan. So that will later this year, it sounds like, be under Blue Cross and Blue Shield. When can you enroll in that Medicare Advantage plan? Again, during your 7-month initial enrollment period. Each year, again, we would tell you to look at this, which is during open enrollment, October 15th through December 7th. Review it, make sure it's still the right coverage for you, and your coverage would begin. So this one runs on an annual basis. You're signing up for that plan. So it begins on January 1. And there are can be some special enrollment plans. I'm not going to talk about this chart this week. It's something you can look through. And when you come for the next presentation, we will have covered most of the material on here, but this is sort of food for thought. Medicare.gov site, this just shows you what it looks like. When you get into that and have your Medicare number, then you're going to want to create an account, because that's how it's going to save your information and you can manage your information and all. So this is just showing you the screen you're going to go into to create that account. So if you do create that account, which I highly recommend, even if you have somebody in your family do it for you, if you're not used to being on the computer a lot, you can do all of these types of things in there. You can review your prescriptions, you can run the prescription drug plan comparisons, you can look at your statements, you can figure out what you're eligible for, you can make sure it's charging you the way it should, and there's a link down at the bottom of this chart that'll help you give you some directions on Medicare Plan Finder. So there's some things that were new this year, and this you can read at your leisure, but just be aware, coronavirus coverage is covered by Medicare, and the vaccines that are coming out are covered fully by Medicare. One of the nice things that changed this year is, for insulin used to be very expensive for many people. There's a senior savings model that covers many of the insulins with many of the plans, and that will then limit the cost per month to $35, which is much cheaper for people than has often been the case in the past. The other thing is that folks with end-stage renal disease can now join a Medicare Advantage plan. They could not before. And as you can see, there's a lot more virtual services, limited acupuncture for back pain in particular, has been added, which was not there before. So this year it's important, more important than ever, to make sure you get your flu shot. And as the COVID-19 vaccines become available, which I know is a hotspot for everyone, please go out and think about getting those. Talk to your doctor about it, if you have reservations, but it's a good way to protect your health. The next to last thing actually we'll cover is, do you qualify for a Medicare Savings Program? So the way to read this chart is the first 3 rows are federal programs. This is something you saw in some of the other charts. So these are going to have an individual monthly income limit or a married monthly income limit. And then it's going to also have an asset test. If you qualify for these, then if you look at the right-hand side of the chart, it's going to tell you what it helps pay for. So the QIMBY would be very equivalent to like a Medicaid kind of level, and it's actually going to cover most of your costs. Your Part A and Part B premiums, if you have them, as well as other cost sharing and deductibles and co-insurances. A SlimB, as you see, has a little higher level here on your incomes. But that's only going to pay for your Part B premium. If you qualify for the first 2, then you automatically qualify for Social Security Extra Help. That's the one that's designed to help you with your prescription and your prescription premiums and deductibles and copays. As you can see, that's yet a higher level there on your income and assets. In case you get confused about these, let's say you have a 401k. If that's just sitting there in the 401k, that counts as an asset. When you start taking distribution from that, and then it becomes part of your monthly income. So this would be, all forms of income. Assets, by the way, do not include your home, your car, and like a burial plot, but it pretty much includes anything else. The one that we have a lot of people eligible for is SPDAP, Senior Prescription Drug Assistance Plan. And the reason we have so many on that is because there's no asset test. And as you can see, the limits on income are much higher. So if you do qualify for this, then each of you, if you're a couple, each of you could get up to $50 per month towards your premium. So if your premium's $30, it's going to pay $30. If it's $65, it's going to pay $50. So up to $50 each towards your monthly premium, and you're allowed to change your plan during the year once, which can come in handy if all of a sudden you get an expensive drug prescribed. So if you think you're eligible for any of these, the best thing to do is call us and we can help you work your way through it, as well as fill out applications, etc. The other thing we do through the SHIP office is the Senior Medicare Patrol. And this is really trying to detect and prevent Medicare fraud. Medicare loses about $60 billion a year in abuse and fraud. So first off, treat your Medicare card just like you would a credit card. Don't be giving out that number. Keep an eye out for identity theft. Medicare will not call you or visit to sell you anything. So if somebody's trying to call you and say they're Medicare and give them, they want your Medicare number or to sell you anything, say, just hang up. That's your best bet. The only time Medicare will call you is if you've put in something to them and they already know all that information and they're calling to clarify something you've asked them to research for you. Or if you've called in to the central number and it says, it'll be a 2-hour wait, would you like us to call you back? But you know you made that initial call. So other than that, just assume it's fraud. And the only people you should be giving out your Medicare number to are your doctor or other Medicare provider, or if you're working with us, for instance, at SHIP. Do look at your summary notices. That's what talks about what services you've received. You can figure out if it was something that you didn't have done, or if it wasn't ordered by your doctor, or if there's some double billing. The first thing you do in a situation like that is call the provider, because very often it's just a administrative error of some type. If that doesn't clarify it, just have your information and documentation handy, and you can contact either us or the Central Medicare, and we will help you figure out what needs to be done from there. And this is free and it's a confidential service. Last but not least, just as a reminder, we're the SHIP office as well as the Senior Medicare Patrol. You can reach us through the central number of 410-386-3800 or direct line to Nicole Renewal, who is the full-time person that works with this. She's the director for Carroll County. And her number is 410-386-3806. And we're here to help you. So we never mind repeating ourselves. We never mind answering questions. Please contact us if you have any questions. And we'll look forward to sharing part 2 with you in the future. Thanks for attending and going through the education. Bye-bye.